Well, cancer patients are most beneficiaries of fertility preservation, as well as elective fertility preservation patients who come to have their oocytes vitrified due to age-related fertility decline. We started our fertility preservation program in 2007, so we have more than 10 years of experience in this practice. During this period, we have observed an increase in the demand of elective fertility preservation. So at the beginning, in 2007, it was 2% in this group, until 22% in 2017. And on the contrary, it was steady at 2% for the demand of fertility preservation among cancer patients. This data was included in our very recent study published in Human Reproduction, which is the largest series published so far on this matter. So this study included over 5,000 patients doing elective fertility preservation and over 1,000 cancer patients. Among them, 641 have returned to use their oocytes among elective freezers, and 80 patients diagnosed with cancer have returned to after pregnancy using their oocytes. So the aim of our study was to provide both patients and clinicians with valuable information about the scope of the approach, success rates, and limiting factors of oocyte vitrification as means of fertility preservation. So in this study, we observed that elective freezers were significantly older than cancer patients. So 80% of our patients were aged over 35 years old. And on the contrary, cancer patients were younger with mean age of 32 years old. As a result, we retrieved more oocytes in cancer patients. So the number of oocytes retrieved and finally vitrified were significantly lower in elective freezers. So remarkably, the ovarian reserve was not impaired in cancer patients, as shown by total number of oocytes and mature oocytes in age matching groups. However, cancer patients showed lower reproductive outcome than elective freezers. For example, survival rate for patients under 35 years old was 80% versus 90% in elective freezers same age. And cumulative life birth rates were 25 versus 40% in the same age group. On the other hand, we were not able to prove that this lower reproductive outcome was due to the cancer disease itself, as shown by the odds ratios in our logistic regression analysis. On the other hand, the number of oocytes used by the patients was closely related to success. For example, if the patient was young, under 35, and used 10 to 15 oocytes, the outcome was from 40 to 70%. And if they were older than 36 years old, then the outcome was 25 to 40%. So in conclusion, our study shows that fertility preservation is an efficient option which can ensure success rates in the future. Reproductive outcomes are closely related to the number of oocytes used by the patient and by the age of the patient, and that cancer patients show lower outcomes, but we cannot the role of cancer in the outcome needs to be definitely ruled out in additional studies.